Hello, everybody. Good afternoon. Welcome and thank you for joining us once again for the weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Vagilla, Hispanic Public Information Officer, and joining us today is Health Officer Dr. Krisha Davis, pardon about that, Dr. James Bridges, who is Acting Director of the Department of Health and Human Services, Mr. Sean O'Donnell, Program Administrator, Public Health, Emergency Preparedness and Response for the Department of Health and Human Services, Dr. Earl Stoddard, Assistant Chief Administrative Officer, also from the Department of Health and Human Services, joining us today, Ben Stevenson and Sarah Rose. They might be able to answer some questions regarding fentanyl and opioids. And last but not least, Maryland Delegate Bonnie Collison is our special guest today. Thank you, everyone, for joining us. And good afternoon, Mr. County Executive.
Good afternoon. And again, thank everybody for being here again this afternoon. Today marks the first day of National Women's History Month, and it's a celebration that highlights the contributions of women in our country's history. I know when I was a teacher, I like to remind my students that one reason you see, a dearth of women in early American history is they were excluded from professions and from education. And so that people need not only understand what women have done, but they need to understand the road they've taken to get to a better place. And this country was not always welcoming and inclusive of its women. And so that's part of women's history. And I'm glad always that we highlight that as well. This county's had many great women and who've helped shape who we are and where we're going. And we now have a council where the majority of the council members are women. And this is the first day of Women's History Month. I want to welcome Delegate Bonnie Collison and congratulate her on just being named Vice Chair of the Health and Government Operations Committee. One big thing she's working on is strengthening Maryland's Prescription Drug Affordability Board. This board will have a huge impact on people's lives by setting upward payment limits on prescription drugs. These medicines are not simply a commodity, but in many cases, they're a life-saving necessity. We need a medical system that doesn't force people to choose between life-saving drugs and food and rent. Delegate Collison's a former MCPS teacher like myself. And I want to give her an opportunity to talk about what she's been working on in Annapolis and here in Montgomery County before we take a few questions. So that said, I'll turn this over to you, Delegate Collison.
Thank you very much, Mr. County Executive. I really appreciate the opportunity to be here today and talk about what is happening in Annapolis with respect to healthcare in the state and the kinds of discussions that we're having. Folks have to understand we're right in the thick of session and lots of bills are being discussed, lots of good policy. We are working the bills through the process. It takes the full 90 days to make sure that they get all the way through. So things that I'm talking about today are still in that discussion process and haven't actually passed both houses, but things that people, I hope folks will pay attention to as we go through these 90 days. And I'm beginning my 13th year serving in the House representing District 19 in Montgomery County. And in my tenure, we've made a commitment as a government to doing everything we can to make sure that everyone has health care and health insurance in Maryland. And we have, and we've also made a commitment to health equity and equitable access to all programs that will support people in their healthcare needs. And this year, first year of a new term, we are seeing some really significant legislation come forward that's driving, that is responsive to those commitments. So I wanted to highlight a few of them. One is we are struggling, and I know that Montgomery County is doing is feeling this as well, but the state healthcare workforce is greatly reduced. Lots of things happened during the pandemic, and people left their professions. People who could retire did retire, but it left us with significant losses in our healthcare workforce. So there are a number of bills this year that are designed to help us recover from this. And one of those workforces is behavioral health, our behavioral health workforce. There's a bill that would create a fund that would support the education, training, and licensing of members in our behavioral health workforce, which was significantly impaired before the pandemic and continues to be so. But it's a way for us to try to bring people into the profession. So that's a major issue we're addressing in several different bills. And I think we're going to see some good progress in us trying to find pathways for folks to move into healthcare professions. And then with insurance, and I am the chair of the Insurance and Pharmaceuticals subcommittee, we are working on expanding healthcare. I personally am carrying two bills. One which would direct the Maryland Health Benefit Exchange and the Maryland Department of Health to collaborate on a study of what we would need to do as a state and how much would it cost to expand our public health options, all of our public health options, to every resident of Maryland, regardless of immigration status. So, we're working through that bill, and we have the support of the Health Exchange. They said they can do it. We're working with the Health Department, who already has a foundation of a study that will do this. So that would go a long way, I believe, in helping a lot of our residents who, while it's perfect, they're perfectly allowed to buy private health care, but they can't afford it. And so we are looking at ways that would incorporate them into our public health safety network. The second bill that I'm carrying would require our Health Benefit Exchange to ask for a federal waiver that would allow all of our residents, regardless of immigration status, access to our healthcare exchange. On our healthcare exchange, we have some of the lowest premium costs in the country. We have managed it really well. We've incorporated 5 insurance companies, lots of navigation, and people can have choices. But right now, under federal guidelines, undocumented immigrants do not have access to those programs. So this has been done in the state of Washington, and we're hoping that we believe that the federal government will agree that in Maryland, we would like to expand that as well. But in terms of public health, overall public health, we've decided that we need to really work on it in the same way that we worked on education, which was going to take a deep dive into what currently exists and what we need in the state to help all of our folks be healthy, basically. I need to say up front, it's beneficial to the state in order for all of our residents to have access to healthcare, because healthy communities are thriving communities, economically thriving, not just health-wise. So I want to say how important that is. So we have a commission. We are working on creating a commission that will study our public health programs and see, what we need to do to fill in the gaps and to create pathways for people to enter. Behavioral health, mental health, behavioral health, you all know, have been a significant issue. And again, we're going to try to address this by studying it intensely, bringing all of the stakeholders together in a large commission that's going to look at all of the different programs that exist, considering how to navigate all of the different programs and increase the workforce and make sure that folks are getting the mental health services they need prior to doing something that will land them in jail. That's a bill that's coming from Delegate Wood, District 20, Delegate Moon from District 20. And it's a very comprehensive study. It would be a 4-year commission, and they will come back to us with with some recommendations. And the county executive mentioned our commitment to trying to keep drug costs down. We had to reinstate our prescription drug affordability board. What this board is doing and has been doing for 2 years is looking at the drug pricing chain, all of the different elements. And there are about 5 or 6 different parts to that chain. And every part of that chain is making a profit, is designed to make a profit. So, and it's coming about in legal ways, but sometimes ways that are hard to understand and less than transparent. So the board is really trying to identify what's happening through that pricing chain and identify what we call drugs that present affordability challenges and determine whether or not it's in the best interest of the state to set upper payment limits. I have to be clear about what those are. Those are the amount the state will pay for a particular pharmaceutical. And local governments are included in this as well. It's not, we're not price setting. We're just saying, this is how much we as the state will pay for that particular pharmaceutical. And it's already having an impact. Even though we haven't gotten to the discussion about upper payment limits, having the board scrutinize what's happening in that chain, we already see some responses. So, and we were the first to have this kind of a board in the country. And now there are 5 or 6 states that are looking to set up their own boards because they see the value. I think my time is short, so I just want to remind folks that, you can follow the floor, all of these bills on the floor and in committees by going to the Maryland General Assembly website. And with that, I'll open up for questions.
Thank you, Delegate Collison. Members of the media, remember to use the chat for the Q&A portions of this presentation. Now we will take questions for the delegate and the county executive regarding this particular topic. And I see Steve Bonnell from Local 360 has the first set of questions. Good afternoon, Steve.
Afternoon. Thanks for taking the time, Delegate. On the prescription affordability bill, have you heard anecdotally, I think we hear a lot at the national level about insulin costs and whatnot, but what have you heard in this state, particularly about how much these drugs, these prescriptions are costing? Do you have any ballpark figures in that regard?
Are you speaking specifically about insulin?
It could be insulin. It could be any drugs that you think are, prompting obviously this legislation, I guess.
Well, what we were seeing is that insulin actually was the impetus, because the cost of insulin went up 500% over the course of less than a decade. So something that used to cost, $10 a vial is now, $500 a vial. So what the board is doing is identifying other drugs like that, where there have been dramatic increases. And they look at 2 things: bills that are, drugs where the cost has increased over 300%, any generic drug where it's increased over 300% in 3 years, or drugs where the initial cost is really significantly high. So in terms of what the amounts are, I can't give you specific amounts, but there are drugs that are on the market right now that are $1 million a year for one prescription. And
we know what those are for, used to treat, or is that still? Go ahead.
A lot of them are the biologic drugs, and they treat the systemic diseases primarily. One that we hear a lot about is like Crohn's disease, psoriasis. Those kinds of drugs tend to be very expensive. And again, what the board is doing is not saying, this is too much, we can't we can't pay that much. But they're saying, is that cost justified? And if so, we're going to pay it. But if it's an example of a manufacturer abusing the patent system, which we have seen, where they, a drug that they have is going off patent, and they find a way to make a minor change, even sometimes in the coding of the medication, which generates a renewed patent, and which means that they can keep the price of that drug higher rather than allowing generics on the market. So that's the kind of thing that the board is looking at.
And then the only other question I have is on kind of the behavioral health front that you're talking about. When you're starting to explore the bills that will address this, I could think about these people, whether they're paid enough. Is that the primary issue, or is it, obviously the pandemic burnout? Those are the two things that come to mind. Is that it, or are there other kind of factors?
Well, I think those are two major factors. I don't think those are the only factors. And I think, we have a history in this country of not seeing mental health issues as real medical issues. And it was the ACA that sort of changed that, or is pushing to change that mindset. Whether or not we're completely there, I don't know. But under that mentality, those services were reimbursed at much lower rates. With the new mentality we're looking at, and the ACA requires parity in payment and reimbursement. So the amounts of reimbursement have actually gone up for our behavioral health professionals, but there are not enough of them. I mean, I think that I've heard there's like only 3 pediatric psychologists in the state. And, the mental health of children is something that we're all very concerned about right now. So, we need to build that workforce, but reimbursement is an important part of it.
Thank you, Delegate.
Thank you, Steve. Any more questions at this time for the delegate on this topic? Emmanuel Villalobos from Telemundo, I did see that you posted a question related to another topic. We'll address that in just a second. Okay, so Judy Hertz from the Greater Olney News does have a question. Good afternoon, Judy.
Hi, good afternoon. Hi, Bonnie. Good to see you again. I have a question. I heard today that Eli Lilly is quote unquote drastically cutting the price of insulin. Is that as good as it sounds? And will that be a jumpstart for what you're hoping to accomplish in Maryland?
Well, I think it's a response to the fact that the federal government set a cap on how much they could charge for insulin. In Maryland, last year, we passed a bill that said no one can pay more than $35 a month for their insulin supply. So I think Eli Lilly is just responding to the outward pressure. But yes, that's the kind of thing we hope the board will do, because, and it was the board who said we could pass that policy last year and it wasn't going to have a negative effect on the availability of insulin in Maryland because of the research they had done. So yes, I think, the board does play a role in that.
Gotcha. Thank you.
Thank you, Judy. Members of the media, any more questions for the delegate on this topic? These topics? No more questions? Going once? Twice? All righty then. Thank you, Delegate Cullison, for joining us this afternoon. Have a great one, and we'll see you soon.
Thank you. I'm going to hop off to bill hearings. Thank you.
All righty. Thank you.
So I just want to thank Delegate Cullison as well. I mean, that was a really informative look at what we're doing and what she's doing at the state level on healthcare. And this is really important. I saw Eli Lilly's announcement today. The more these companies come under scrutiny for their pricing, and the more people realize how badly Americans are treated in the pricing market, I think the more there's going to be pressure on them to act voluntarily or wind up under more regulations. And Either way works in my mind, as long as it gets us to a better place. But the idea that Americans pay more than anybody else in the Western world for medical stuff, and we do not have as good a system as many other countries in the world, is ludicrous. And the fact that companies in America spend massive amounts on advertising prescription drugs, which you can't even prescribe to yourself. It's not even information for doctors. It's things on TV telling you what drugs you ought to be taking. And you have no way of evaluating whether this is the right thing or not, other than the really cute cartoons they use sometimes. And other countries don't allow that. And just imagine what the reduction in costs would be for drug companies if they were limited to just the facts and just dealing with doctors and having people make the best medical decisions, rather than trying to pressure regular people like you and me to request drugs that we know nothing about because we saw a cute ad on TV. So I hope the delegate and I hope others keep on pushing, because it's an enormous monetary drain on everything we do, whether it's the government or whether it's your personal lives, and it shouldn't be this way. So more power to you, Delegate Collison, and thank you very much for being here. I submitted testimony today on behalf of a bill that would make permanent some major healthcare insurance changes that are making a difference in Montgomery County and Maryland. Since 2021, the state's been helping young adults afford health insurance through the Maryland Health Benefit Exchange. And the investment has been up to $20 million yearly. And last year, around 45,000 Marylanders took advantage of this program. Money is meant to help people between the ages of 18 and 34 purchase health coverage. Getting more healthy and young people into the medical insurance system is important to help foster healthier communities, but it also helps lower premiums for everyone. Enrollment among young adults shot up 500%, providing 17,000 people with health insurance who didn't have it before. And the program is also reducing racial and ethnic disparities for health coverage among young adults. Hispanics have seen very low participation in health insurance coverage in the past. And with this program, they're closing the gap and improving health equity in our state. And it's time to remove the sunset on this important healthcare program that helps so many young adults and families. Also, because it's tax season, I want to remind you that it's easy to enroll for health insurance in the state of Maryland. Just keep an eye out for a box to check your taxes on your tax form. This is an easy way to express interest in healthcare coverage, so you don't have to search out ways to sign up. So there's a checkbox on your taxes. Look at it if you're interested. Check it if you want more information. We can make this simpler. Tomorrow, I'm going up to Annapolis and I'll be testifying on behalf of Governor Moore's Fair Wage Act of 2023. The bill accelerates an increase in the state minimum wage rate to $15 on October 1st, 2023, and indexes further minimum wage rates to inflation up to 5% beginning July 1st, 2025. Increasing the minimum wage is an issue that I've supported for a very long time, since before I was an elected official. And I'm proud to say, I sponsored 2 bills in Montgomery County that raised the minimum wage. And the last bill in 2017 raised it to $15 in Montgomery County. We already have a large group of employers who are above $15. There's another group that'll come into the $15 range this summer, and the governor's bill will bring everybody else in Montgomery County into the $15 range in October. And our bill continues to already has inflation adjustments built in. And so we will continue to be raising wages according to inflation. This is really important, and it is critical for people to be able to put a roof over your heads. I don't know if people realize, but if you made $15 an hour, you make a little over $30,000 a year. If you're a single person making $30,000 a year, and if you spend 30% of your income on housing, which is the upper limit of what people recommend spending on housing, you would have $9,000 to spend, which is about $750 a month. I can only say good luck finding an apartment in Montgomery County. at $750 a month. So $15 is a great start. It was a good number in 2015. We need to continue to push the minimum wage to higher levels that are more in line with what it costs people to live. And I know living costs are different in different parts of the state, but Montgomery County is one of the most expensive places to live. I want to thank Governor Moore for making this one of his earliest priorities, getting out in front of it. And it's an honor for me to testify on behalf of this important legislation tomorrow. Last weekend, I attended the second family forum on fentanyl held this year by MCPS in Montgomery County Goes Purple. There's still a lot of questions from the community about what we're doing as a government to help alleviate this problem. First of all, this is not just a school issue. Since last September, there have been 5 overdose deaths classified as youth. And though that means all 5 victims are under the age of 21, not everyone was a school-age child. And we're focusing on how to help our community and what we can do to address more than just school-age kids. There's prevention work being done with an emphasis on community awareness. The county and its partners can help identify treatment options for kids. But, we all know that we have a, real dearth of beds in the mental health arena. The state of Maryland has never provided the number of beds that are needed. And we struggled during non-fentanyl years to provide adequate mental health services for people, and fentanyl's only made this even harder. And hopefully the state legislature and the governor will be looking at ways to really provide a robust mental health system that the Montgomery County can be a part of and we can help with, but that really requires the state to play a core role in making sure the beds, particularly hospital beds, inpatient beds are available. We're working to identify treatment options for kids who are already using or high risk of use. And we're also doing what we can to make Narcan more widely available. I believe that the feds at some point soon are going to make it available over the counter. This does not mean that we're encouraging people to do this, but we're acknowledging the risk. And, as bad as it is to be doing this, our death toll would be a lot higher, would be multiples of the people who've died this year if we hadn't had Narcan. So Narcan's a preventative. It is not a license to do something incredibly stupid. So Narcan is not something that's going to solve a problem other than keep somebody from dying. The underlying problem is doing fentanyl in the first place. And we know, and we've talked about this before, that some people are using fentanyl straight out and they seek it, but maybe the most deadly form of it is when it's in pills and you have no idea that it's in the pill. And they're being manufactured, they look like other pills. They're not manufactured with any kind of quality control like happens with actual drug manufacturing. So there's no certainty of the amount of fentanyl you're getting in some of these doses. And it's a problem, and it's even harder to deal with when people think they're buying something else and don't even realize what they're starting with. I want to thank Dr. McKnight and her team for their response and engagement with concerned parents. And I want to thank MCPS for their cooperation and partnership, both with MCPD and our high school departments, HHS department, as we work holistically at engaging students and their families to help them be safe and healthy in our schools. I want to bring Dr. Davis on now, who's been working with MCPS and updated our county council this week on our fentanyl prevention efforts. So I'll turn it over to you now, Dr. Davis.
Dr. Davis, please unmute.
Thank you. Thank you, County Executive. While we have seen some promising trends in terms of youth use of illicit substances, we're seeing decreasing use of illicit substances overall, decreasing use of alcohol and cannabis. However, we are seeing that the increase in opioid use, and that the drugs that they are using are more dangerous, more deadly, and more addictive. And we are, working with our partners in developing a public health response to that. I want to just share with folks how we are thinking about the issue in terms of primary, secondary, and tertiary prevention. Primary prevention is really for everyone. It is education and awareness about drug use. It is also building resiliency in our youth and addressing mental health. We know that all of our youth have gone through a challenge in COVID. Secondary prevention is harm reduction and treatment, targeted at those who are already using or at high risk of using. Education around going slow if they are using drugs. Education about treatment and providing opportunities for folks who are using to access treatment facilities. And then tertiary prevention is really overdose reversal for those who may have overdosed. Education around naloxone. It is important to have Narcan available and folks trained in how to use it, but we can't solve the fentanyl crisis by only focusing on Narcan. And so we are really looking at all of these different levels of intervention. We are appreciative, as County Executive mentioned, of the partnership with MCPS, as well as with the police department and with our community partners through Montgomery Goes Purple, in really highlighting the issue and spreading that information across the county. As we look at the response, it is important that we are providing it at all of those different levels in a culturally appropriate way. We do have Spanish-speaking trainers in Narcan, as well as have translated that material into Spanish so that it can be available to the broader community. We are also in the process of scheduling community forums that will target the 18 to 24-year-old population. As we know, that is a group that really is highly impacted, as well as the child and adolescents. And so with that, I will stop there. And if there are additional questions to talk about the response, we also have Ben Stevenson and Sarah Rose, who have been important partners at DHHS in coordinating our response.
Thank you, Dr. Davis. Mr. Daniel, Dr. Bridgers, do you have presentations this afternoon?
Mr. O'Donnell does. I do not. Thank you, Lorna.
Thank you.
Good afternoon. I'll just give you a brief update this week, as we do most weeks, on our current community levels of COVID and influenza. We've seen a lower level of COVID transmissions as tracked by PCR testing. It's leveled off over the last few weeks. It's currently at 61 cases per 100,000. We see lower levels again of the percentage of our beds that have COVID patients in it, but some of the most important surveillance information is that we are currently at under 3 new patients per 100,000 with a COVID diagnosis at our hospitals. So this is showing while there remains transmission of COVID, we've seen a drop off in serious illness resulting in hospitalizations. So we do want people to know these strains are highly transmissible, even if you've been vaccinated. But it looks like those individuals who are vaccinated are seeing the protective effects, and we've had a recent drop off in hospitalizations. Our emergency department visits, as we've been reporting, have remained fairly low in total number of visits. So our hospitals have capacity at this time and are being less stressed than they were during the December and January months. And again, we're seeing relatively steady rates of visits at our hospitals for flu-like symptoms, COVID or flu-like symptoms. So we've been tracking that as well. Looking at where the changes in our COVID patients at hospitals have been, the biggest changes are those patients who were transferred to the alternate care site, with 20 fewer patients at that site this week than last week. And so only a total of 71 patients with across our systems, our hospitals and our alternate care site have a COVID diagnosis at this time. Again, tracking mortality data. We've now been through the month of February. Still will likely have a few more cases that may be verified for February, but you can see that the death totals with a COVID diagnosis have come down from the January, the high mark in January. Still more elevated than some of the other months, but we're hoping to see those continue to recede as we move away from the high number of serious illnesses. Looking over at we still track our bivalent booster rates. We're reporting that about 47% of our residents 50 and older have gotten that bivalent booster, and only 33% of all county residents who are eligible. So we're still recommending, there's only been one bivalent booster offered this year, back since September. So if you haven't gotten your COVID booster since this became available in September, it's still a good time to come out and get it. It's still free at all of our county sites, and most other sites that are providing it. If you have insurance, the insurance will cover it. Many other providers are not charging even if you don't have insurance. So again, we do track and provide this in our pulse report, the rates of boosted doses by age and ethnicity. And just to give a final seasonal report on influenza, much of the nation has seen a significant decline in influenza and other respiratory diseases, just as we've seen here. We've seen across Maryland, the hospitalizations have dropped. That the red line here shows this year's hospitalization rates. You can see after an early intense period of hospitalizations for influenza, these have really receded, and we've moved to this period a little bit earlier than we have in some prior years. Finally, just to give a final report again on our influenza deaths attributed to influenza across the state. We have no new deaths over the last week. Again, we're with the lower numbers of cases. We're hoping that we are through the worst part of the influenza season. And then finally, just a reminder that the county continues to do vaccinations for COVID and as well as for Mpox. And we continue to offer PCR testing at a number of locations across the county. It's actually a much larger number than what we have listed here. So we do encourage you to go to our website to see where those are. There are links to find places where you can do free PCR testing. The CDC has a website up now that we promote on our website. And of course, our libraries are still offering rapid tests and high quality masks for those who need them. That's all the updates I have right now. We continue to track a wide range of other threats to public health. And we'll keep our leadership and the public informed as those threats become something that we need to be more concerned about locally. Dr. Sauter, do you have anything you'd like to add?
No, I think we're ready to proceed to questions.
Okay, thank you, Mr. O'Donnell. I do see first question here on the chat from Manuel Villalobos, Telemundo 44. Emmanuel, do you want me to read that, or would you want to ask a question to the county executive?
Yes, hey, Lorna, thank you all for the opportunity. My question is related to a bill introduced yesterday by the council member Jill Jaguando that will try to stop police officers from making stops for certain minor traffic offenses to focus on the most serious crimes. He's arguing the racial disparities in the county. Do you think this kind of measures are necessary in Montgomery? Thank you in advance for the time.
Yeah. So we were actually already moving in this direction. We modified the rules for police stops so that they have to be focused on the reason why a person was stopped, and officers are not to press for searching cars, for example, absent absent a cause. And so that's already in the protocols for police officers. We also, I've already asked the department, and they've been working on this, to help us with automated enforcement. A lot of enforcement, like with, headlights and taillights, basically, the equipment repairs could be managed simply with a photograph of the vehicle, the license plate, and sending somebody an automated ticket, like you do when you're, when you get a speeding ticket or, go through a red light. There's no reason why we couldn't do the same kind of ticketing for equipment repairs. I don't believe the bill extends to running stop signs and things like that. I think absolutely anything where people are violating the rules of the road, like running through stop signs, speeding, running through cameras. I think it's appropriate for police running through stoplights. I think it's appropriate for police to be able to stop somebody. I think that I would get very little consolation if somebody ran through 5 red lights and police saw them doing it and let them do it. And then that person runs through a 6th light and has an accident. I think we have a responsibility to keep people safe, and we should do that. And I think in the end, the most important thing is to make sure that our interactions between the police and the residents are appropriate. I mean, I'm not interested in not doing things to, focus on safety because we're afraid of the interactions. We need to change inappropriate interactions so they don't happen. So I think, the bill, the way I read the bill right now, I think most of it's okay, but it's not coming up for a couple of months. We'll have time to talk about it.
Thank you so much.
Thank you, Emmanuel. Any other questions from members of the media for the officials this afternoon?
Laura, can I jump in again? Thanks.
Okay, go ahead, Steve. Mocha 360.
Thank you. County Executive, a simple question. The council appointed the 3 replacements to the planning board. Are you planning to confirm Mr. Hedrick, Mr. Bartley, and Ms. Fodim? I'm butchering that last name probably.
I'll be asking them to, come in for interviews, and after an interview, I'll decide what I'm going to do.
Is that a week or 2? I mean, rough timetable there.
I think I've got 30 days if I'm going to do anything, so I'll get all this done quickly.
Okay, thank you, sir.
Thank you, Steve. Any more questions for the officials this afternoon? No more questions, members of the media? Going once, going twice? Well, thank you everybody for joining us this afternoon. I guess we're done. Have a great afternoon. Stay safe, and we'll see you soon. Goodbye, everybody.
Bye, everybody.